Hi, my name's Josh. I'll be your nurse today. Can I have your full name and date of birth, please?
Meagan Diane Bridgeford, 7/29/1996.
Okay. Well, Megan, today we're going to go over some things. I'm going to look at your ears, look at your face and your nose, and look inside your mouth. I'll listen to your lungs. Is that okay?
Yeah.
Okay, well, let's get started. First, I'll just ask you some questions about your ears.
Okay.
Do you have any earaches or pain in your ears at all?
I do.
Can you
On my right side.
Can you elaborate on it a little bit?
It's been happening for 4 days,
Mm-hmm.
and this right gland has actually been swollen.
Okay.
And then today this one actually got swollen.
Okay.
So it just kind of hurt down here.
Painful. Okay.
Like drainage.
You have drainage? We'll look at that later.
Okay.
So, do you have any ear infections currently or in the past?
I've never had one.
You've never had an ear infection. Do you have any discharge coming from your ears right now?
I don't.
Do you have any trouble hearing at all right now?
Not that I've noticed.
Do you have any loud noises at your home that could possibly, like, harm your hearing at all, you feel? Do you hear any ringing or buzzing in your ears?
No.
Do you have any vertigo or spinning currently?
No.
How do you typically clean your ears?
Just with the Q-tip.
Okay. Do you use ear protection from loud noises ever?
No.
Okay, well, I'm going to look at your ears really quick and just see what's going on in there. So if you don't mind, first I'll just feel them. Are they tender at all there?
No.
Okay, now I'll look inside. Okay. Then I'll do a whisper voice test. And
Okay.
so I'll just come up to you and I'll whisper a word, and then you can repeat that word to me, okay?
Okay.
Okay. Can you tell me what I said, Megan?
You said apple.
Very good. So now I'll ask you some questions about your nose. You mentioned drainage. Is it coming out of your nose or is it going back in your throat?
I think it's doing both, kind of.
Okay.
I don't know, 'cause my throat hurts and I have like headaches.
You have headaches. How much drainage is coming out, would you say?
Not a lot that I should be concerned, but just a little bit.
What color is your drainage?
It is green.
Is it green?
Yes.
Is it thick or
Not really.
not really, so it's kind of runny then?
Yeah.
Okay. Do you have any colds or do you usually have colds ever?
I get sinus infections a lot.
Do you have any pain in your sinuses currently?
I do.
Have
I've
you?
been having headaches really bad.
Okay. Do you have any? Have you ever had any trauma or an injury to your nose ever?
No.
Do you have allergies?
Yes.
Okay. Do you know what you're allergic to?
No. I just have really bad allergies.
Just all the time, or
Yeah.
do they get worse in the springtime or in the fall? Which one?
Every time. Like, I don't know, my allergies are constant.
Okay. Do you have any changes in your sense of smell at all?
No.
Okay. Well, now I will just go ahead and look at your nose and sinuses and just see what's going on. So if you wouldn't mind taking your glasses off.
Of course.
Okay. First, I'm going to feel your nose.
Okay.
So just bear with me here. Okay. And now I'll feel your sinuses. So just tell me if you feel any pain anywhere. Does that hurt anywhere?
Kind of down here.
Yeah. Okay.
Yeah.
On your left side?
Mm-hmm.
Okay. Well, now I'll ask you some questions about your mouth and your throat, okay?
Okay.
Do you have any sores on your mouth or in your mouth or on your tongue
I don't.
currently? Okay. Do you have a sore throat from the drainage or anything?
Yes. I've been coughing a lot when it comes to nighttime.
Coughing a lot. On a scale of 1 to 10, how bad would you say your pain is?
I would give it a 6.
About a 6?
Yeah.
Okay. Do you ever have any bleeding gums whenever you brush your teeth?
Mm-mm.
Have you had any changes in your sense of like taste or anything related to like your impaired sense of smell or anything?
Mm-mm.
That's good. Do you have any hoarseness or voice change with all the coughing and stuff lately?
No.
Do you have any difficulty swallowing at all?
No.
Do you?
Not that I've noticed.
Okay. Do you drink alcohol?
I do not.
Okay. Do you use a nasal spray currently?
No.
Do you use any illicit drugs through your nose at all?
No.
Okay. Well, now I'll go ahead and look into your mouth. So is that going to be okay?
Yeah.
All right. Well, I just need you to open your mouth and stick your tongue out and open your mouth wider, please. Thank you,
Thank you.
Okay. Well, I'm going to ask you some questions about your lungs now, and then we'll go ahead and look and listen to those, okay?
Okay.
So you said you have a cough. Can you tell me about it?
It just happens at night. That's the only time I've ever noticed it.
Do you have any shortness of breath along with that?
No.
Do you have any chest pain with breathing?
Not really.
Do you and your family have any past history of lung disease at all?
Mm-mm.
That's good. Do you smoke cigarettes?
I do not.
Do you have any living or working conditions that could affect your breathing?
No.
Can you tell me when your last TB skin test was?
No, I cannot. I don't know.
Have you ever had one?
Yes.
Okay. Do you know when your last chest X-ray was?
It was like 4 or 5 years ago.
Okay. And what about a flu vaccine?
I've never got that.
Never had one. Okay. Well, that's fine. I'm going to go ahead now and listen to your lungs.
Okay.
And yeah, we're going to listen to them. We're going to do a little test, and that'll be fine. So, I need to go ahead and palpate your trachea, if that's fine.
Okay.
And I'll feel your
Sorry.
stuff as well. So let me just feel here. Okay. And I'll feel your trachea. Okay. Now we'll do a test where I'll put my hand on your back, and I need you to say 99 clearly. So
99?
99, yes
Okay.
ma'am. So if you could say it one time.
99.
Once more.
99.
And one more time.
99.
Very good. Now, I'll just go ahead and listen to your lungs. So, if you wouldn't mind just sitting forward a little bit. I'll just swing around here and just breathe like you normally would. Okay, Megan, well, you sound really good to me. Your lungs sound clear, so that's good.
Okay.
So, do you have any further questions for me or anything about what we've talked about today?
No, I think you've made everything clear.
Okay, well, thank you very much for coming in today.
Thank you.
And, yeah.
Have a good day.
You too.
Thanks.
Oh, man. Edit that one out.